Hey everyone, welcome back to another emergency medicine flip video. And in this video, we're going to be talking about patient assessment. Really important topic. Here's your key objectives that we're going to do in this lesson. And this is part one of our patient assessment series. We're going to talk about the scene size up and our primary assessment. So make sure you know these at the end of the video. All right, so patient assessment, it's probably my favorite thing to teach and to practice and to do in emergency medicine when treating with patients. And really what it comes down to is exactly what it sounds like, finding out all that is wrong with the patient. So we need to assess the patient to find out what's going on. And I think this is the most important skill as any medical professional, whether you're an EMT paramedic or all the way up to a doctor. You have to have good patient assessment skills to figure out what's going on. And no matter what level you're at, whether you are a doctor or you're an EMT basic, the good patient assessment is based on the same skills. So the doctors do a lot of what we do out in the field. And it's really important to think about the many different types of situations we're going to have patients. It might be a medical call, might be a car accident, might be a fire, might be a mass casualty incident like we've talked about. So really taking that into account. And the first step of any incident or well, actually, I'm going to take a step back here. And this is kind of an overview of what patient assessment will look like. So today, we're going to just briefly go over the first two parts, the scene size up and the primary assessment, which has all this stuff here, all right? And then in our next video, we'll talk about the secondary assessment, which has several parts to it as well. So there's a lot of stuff here. And the way this is going to work for the flipped lessons here is we'll do an overview here in the flipped lesson, and you'll see as we get into it, like when we talk about Airway, I'm not going to go into the steps of how to do the stuff in the Airway, but we'll talk about the big ideas. When you come into class, we'll go into the specific steps and be able to practice and do some of these actual skills. All right, so this is what it looks like. And today we'll be doing scene size up and primary assessment overview. So again, looking back at these situations here, right, we see a car accident, a house fire, mass casualty, Boston Marathon bombing. The first part of any incident, any patient assessment is two things: to make sure the scene is safe, right? We want to always say and think about scene safety, right? As soon as we show up to a scene. So is there a fire, right? Is there an active threat to rescuers? Here we see some Boston EMS people during COVID-19, right? Is that scene safe? This is a really precarious position for these guys to be in. That car's teetering over the edge of a bridge. I would hope that maybe they put some supports down here, right? We need to make sure our scene is safe, because if we get hurt, we can't help the patient. And we become more patients and put more of a stress on the EMS system. Okay, so first is scene safety. The second thing for every scenario, every patient contact, is BSI, body substance isolation. All right, and if you remember back from our rescuer basics video, we need to take the standard precautions to protect us from unprotected exposures. All right, and this is really a huge thing right now with COVID-19 going on, and you can see that picture on the top left, right? We need to protect ourselves and use the proper PPE, whether always wearing gloves, number one. BSI normally means just wearing gloves, but right now, always wearing a mask, putting an N95 on if we have to, wearing a gown or some type of Tyvek suit like that. Really, really important to take those standard precautions. So first two things are really scene safety, BSI, and then we need to get permission to treat, you see at the bottom there, right? We talked about in our legal chapter that if you touch a patient that doesn't want to be touched, you just committed battery. All right. So first thing is saying, hey, my name's Chris with so-and-so EMS. Is it all right if I help you? And if they say no, we can't go right out and just start doing an assessment and touching them, right? That would be battery. We need to talk them into it, hopefully, and convince them to at least let us talk to them. All right. So scene safety, BSI, always the first two things, the most important. And then we need to get permission to treat. All right. So the first step, if you remember here, is our scene size up, right? If we talk about this big flow chart here, scene size up is our first step. Primary assessment is a second step. So as we go through all of patient assessment, I like to teach it with acronyms, all right? Or mnemonics, they're called. Ways to remember what to do for each one. That, if you don't like them, you can think of some other way to remember it. You can just straight memorize, but I like it. It helps me remember. And even in real life EMS, when I go and see a patient, I run through my acronyms. I say Lisa, A, B, C, D, E, A, OSO, and I go through all of them, which we'll talk about in these videos, all right? So what is a scene size up? Think about it. You're called to a scene on the ambulance. You're called to a car accident. you're called to have someone having chest pain. It's the general overview of the incident and its surroundings. So what's going on, all right? And I like this picture here because the scene size up starts with the dispatch center, right? They give us information. So they say, you're being dispatched to an 85-year-old male with chest pain. And you go, chest pain. All right, what should I start thinking of? What might this patient present as? What treatments might I have to do? Same thing if you get dispatched to a car accident. What do I have to think of? What tools might I need or resources? So the scene size up is painting a brief picture to get what's going on. And this should only take about, I don't know where my writing tools went. It should only take 30 seconds, something to know. So a scene size up, once you get on scene, should really take 30 seconds. And the acronym or mnemonic I like to remember for scene size up is LISA. And again, in class, we'll get more in depth on how to do these. But LISA stands for life threats. So is there something that's going to kill them in the next 90 seconds? So severe bleeding, not breathing, amputated limbs, which would be severe bleeding, right? Things like that are life threats, not, oh, their arm's sore, or, oh, yeah, their chest hurts, or something like that. Okay, so life threats, what's going to kill them in 90 seconds? I for Lisa. The general impression, which contains the chief complaint. And the chief complaint is the reason that somebody called 911. It's their main complaint that they have for their medical issue. Okay, so the impression is age, gender or sex, and the chief complaint, right? So I have an 85-year-old male with chest pain. I have a 16-year-old female with a sore right leg. My impression. S. So is there a spinal or head injury, right? Do we need to think about protecting the spine? So yeah, if somebody was ejected from a car in a car accident, I'm definitely going to be thinking about protecting the spine. If somebody fell off a 10-foot ladder to the ground, I'm going to be thinking, ooh, this could be a bad head, spine, neck injury. I'm definitely not going to move them until I have the proper tools and resources there. And then finally, AVPU, okay? We'll talk about what AVPU means, but what the letters for, but it's actually an acronym mnemonic within an acronym. So Lisa, the A is AVPU. And for right now, all you need to know is AVPU is a way to assess mental status, okay? It's a way to assess mental status. And each letter actually stands for something. Alert, verbal, pain, unresponsive. But we'll talk about those. So AVPU is a way to assess mental status. All right. So again, the scene size up, when you do this, it starts with your dispatch call, but once you're on scene, it only takes 30 seconds. Lisa, life threats, impression, spine, and AVPU. All right. And really thinking about, why did you call 911 today? What is going on that I need to be here for? This way, when we get into the primary and the secondary assessment, we could dig deeper into that problem and figure out what's going on with the patient. Two other words here to think about when we're thinking about our scene size up and the chief complaint, why do we call 911, is one or two things we need to figure out. And this usually happens in the scene size up is if someone is injured, a trauma, which we've talked about, we need to find out the mechanism of injury or how someone was hurt. So again, they fell off a ladder. They got hit with a baseball. They got punched in the head. Things like that. They got thrown out of a car, or even they just got in a car accident and the airbags went off. Okay. Now, if you have a medical issue going on, not a trauma, we call that the nature of illness. So if someone's having chest pain, right, that would be the nature of illness. There's something cardiac going on. They have chest pain, or maybe they're having an asthma attack. That would be the nature of illness, right? So the chief complaint, we need to figure out either the mechanism of injury or the nature of the illness. So moving on, so pause the video here if you need to go back and fill in any of the blanks on scene size up. 30 seconds, Lisa, and then these two words down here. So that's our brief picture. Now we need to get a little more in depth, and that's in the primary assessment. And this is where we form a really good general impression of the patient. And the key is right here. We identify and immediately treat any life threats that we may not have known about here in scene size up. So obviously, if you see a giant puddle of blood with life threats, you're going to treat that. But maybe we get a little bit further into our primary assessment. We see something wrong, we treat it. So identifying life threats. A good primary assessment should take you about 2 to 3 minutes, depending on the patient. Sometimes it could be less. If you have a really stable patient, it could be like 30 seconds. Okay, but generally 2 minutes we want to do it in, 2 to 3. And the primary assessment here has kind of evolved over the years. It used to just be A, B, C, D, E, but now we think about it as B, A, B, C, D, E. All right, so the letters of the alphabet, but starting with B. B, A, B, C, D, E. And these stand for, again, we're going to go in class, we'll go way in depth on these. Well, we have a couple slides to talk about them here, but we're going to go way in depth on these, all right, more of them. So the first B for bleeding, right? And that kind of plays into that life threats in Lisa. So, excuse me, is there any major bleeding we need to control? Then A, B, C, D, E. Maybe you've heard the ABCs before, like in health class. So airway, breathing, circulation, disability / decision, and then expose. All right. And we can see here, right, we have an EMT talking with a patient that looks like some kind of medical, and we have somebody in some tactical gear here, whether it's police officer or a tactical EMS person doing like a blood sweep. And we'll talk about those. So primary assessment had these 5 parts, okay? Breathing, airway, or excuse me, bleeding, airway, breathing. Yes, I see the 2 A's there, just making sure you're paying attention. Breathing, circulation, disability, expose. So let's go through these real quick. All right. And again, we're going to get more into these in class and throughout the year. So bleeding, right? Address severe bleeding and any significant blood loss. So that doesn't mean like, oh, I have a little cut on my hand or, oh, I got a little cut on my cheek, right? Significant blood loss is spurting blood that's shooting out of something, a hole somewhere, puddles of blood on the floor, or clothing that's saturated with blood, right? My big Burlington sweatshirt here could really soak up a lot of blood, and it might be hard to tell. So if you feel clothing that's wet with blood, that's significant bleeding. We need to stop that before we do anything else. And we're going to do Stop the Bleed in class in a few weeks here. And it's just really important to remember that bleeding is probably the #1 cause of death in a trauma. And then obviously CPR and cardiac arrest is the #1 cause of death. But bleeding is the most preventable type of death we could fix in emergency medicine. So it's really important stuff. And that's why it's first, right? I can do a really great rest of my assessment, great treatment. But if I didn't stop that bleeding in like 30 seconds, you might lose so much blood that you die no matter what I do. So bleeding is first. You're going to perform a blood sweep, but you can see this guy here. And again, we'll learn this in class. Start from the head, and you're going to work your way down, just feeling the person and looking at your gloves. And if you find blood, you better find it and treat it, okay? And again, significant bleeding, not minor cuts and scratches. And we'll go over all this Stop the Bleed stuff in class. So B, bleeding. Now we just roll into the alphabet. A, airway. So an airway is how air, which has oxygen, enters your body. All right, and we can see a nice picture here. We actually have 2 holes, right? We have the mouth, the oropharynx, and the nose, the nasopharynx. Both these connect to your trachea, which is the tube on the front of your throat, or the front of your neck, right? And basically an airway is just the openings to get air down to your lungs. And we have upper airway, we have lower airway. We'll talk about all this as we go through it. So airway, right? How air gets into the body. And again, all these A, B, C, D, E's, I have little acronyms within them to remember, and this is how I like to do it. So airway, I always think OSO. So open it, right? We'll talk how to do this. So right now, all you need to know is OSO. Open, suction, suck any good chunky bits out, some nice chunky vomit, and OPA, NPA. And those are actually acronyms within an acronym within an acronym. So really good stuff, though. And you can see on the bottom here, we'll talk about these OPAs and NPAs. On the left, you'll see somebody inserting an OPA into a child. On the right, an NPA. And in the middle picture, there is a set of OPAs, which stands for oropharyngeal airway adjunct and nasopharyngeal airway adjunct. You don't need to know that right now. OSO, open, suction, OPA, NPA. So after airway, which is getting the air through the hole, breathing, right? The act of pulling that air into the lungs for oxygen. So airway is just the nose and the mouth. Breathing is how we get it into our chest, into our lungs, so we could get that good oxygen out of the air and into our bloodstream. And for breathing, I like the acronym Oh, I pass. Like, oh, I passed the quiz, or oh, I passed the test. Some people say OIPAS. I like, oh, I pass. So think about supplemental oxygen, right? Giving somebody supplemental oxygen. We'll talk a lot about this. There's been a lot of updates to it, and we hear a lot about it now with coronavirus too. But we need to give oxygen to somebody who does not have significant oxygen saturation. So, oh, I pass. Oh, oxygen. I, P, and A have to do with assessing somebody's breathing. So we're going to inspect the chest, which means we're going to look. We're going to use our eyes to look for full and equal chest rise. If you take a deep breath right now, you'll see on my video, and hopefully you'll see on yourself, both sides of your chest, because you have two lungs, one on each side, rise equally. We call that bilateral movement. So inspect the chest. P, palpate the chest. You can see right here, you start at the top and you're feeling for anything weird, anything crunchy, and you're going to ask that person to take a deep breath. As you can see, the hands are right here. Take a deep breath, and you'll feel your hands, hopefully both of them move up and out. So I, inspect, P, palpate, which means touch, if I didn't say that already, but P, palpate, touch, you're feeling the chest. And then auscultate, which is right here, fancy word for listen. And we use a stethoscope to listen to lung sounds. Now, you could spend a whole career, you could be a pulmonologist and know all about lungs, and there's many, many, many different types of lung sounds. What we care about really as EMTs, unless you're highly trained and have a lot of experience, is do I hear any noise and does it sound funky, right? If I hear noise on one side of the chest and none on the other, that means that this lung is not working properly. Or if I listen to my stethoscope and I hear all sorts of funky breathing, high-pitched noises, crowing, wheezing, anything not normal, and we all know what normal sounds like, that's going to be something to note, all right? So auscultate, listen. And then finally, seal, S, seal a sucking chest wound. We're going to have a lot of fun talking about this in class. The long story short is if you poke a hole in your chest, air will then go through the hole every time you breathe instead of your mouth. That is not good. We do not breathe through holes in our chest. So when that happens, we need to put a special type of dressing, like a piece of tape, over it. And we'll talk all about that. So for breathing, O, I pass. Oxygen, inspect, palpate, auscultate, seal, sucking chest wound. Nice. C, circulation. And hopefully you guys are getting way too young. Mr. Toad is showing his age here. But back in my day, if you had a VCR, that was some hot stuff right there, right? VCRs, which was the old tape you used to put in to watch Disney movies. So, V, the voids. We kind of did this all the way back at the beginning with bleeding, right? We did a blood sweep. We checked the voids for bleeding. But again, in circulation, if you didn't see any blood or maybe you start to see some, check the voids with your glove. Do a blood sweep. So CR, we're going to check pulses. So one of two things here. A carotid pulse is this one right here, your carotid artery that runs up your neck and into your brain. And your radial pulse, which goes out to your hand here. It's the side closest to your thumb. And you could feel those on yourself with your fingers. We'll learn how to do this. But we're going to check a pulse at the beginning of every patient assessment. And that doesn't mean I'm actually going to take a rate. So I'm not going to sit here and feel and count how many beats per minute. I just want to get a quick, A, make sure I feel it, and B, just get a sense. Is it strong? Is it super, super fast? Is it slow? Do I feel like it's not normal? It's not in a good rhythm, right? I'm just getting a quick feel to see that it's there, all right? So carotid pulses, this one we should write down. We check a carotid pulse in an unconscious person, like this guy here. And if our patient's conscious, we just do a quick, oh, can I see your wrist? And just feel their pulse real quick. See how it feels. Hopefully nice and strong and regular. All right. And then the last thing, S, we assess is the skin. Okay. Normal skin, we check for, we'll get more into that. Well, actually, we'll get more into this in class, right? But we're going to check the skin too. So that's VCR, so circulation. All right. Disability, decision. Basically, two things to think about. So really, we did the three things that are going to kill you, right? We talked about bleeding. We talked about airway, and we talked about breathing, and we talked about circulation, which kind of goes with that bleeding. So we talked about the ABCs. That's what's going to kill you. Our D, in other words, in the patient assessment, if we don't treat it, that will kill you. Our D and E are a little bit more like, all right, let's close up the patient assessment. We'll finish up the primary assessment so we can move to our secondary assessment, and we can start to treat the patient. So D, disability. Does the patient have any complications that might indicate a neck or back injury? Because if so, we really need to be careful about working and moving with this patient, and we need to take the appropriate precautions. And we'll talk all about head, neck, and back injuries, but is someone acting funny? What was that mechanism of injury? Do we see them posturing like this, which is when you're unconscious and your body flexes, shows a serious head injury? Okay, and then the D, decision. I add that in there. Not every EMT instructor does, but I think about, all right, we did our scene size up. We did our primary assessment, ABCDs. We need to think, is this a load and go patient or a stay and play. And not that we ever stay on scene more than we have to, but if somebody, and I have a couple examples down here, right? Like this guy's got a sore shoulder. This guy is in cardiac arrest and they're doing CPR, right? The sore shoulder, we can kind of take our time a little bit to assess and get them nice and splinted. Somebody who's not breathing, or if we're doing CPR, if they have extreme bleeding, we need to do what we have to do and then get them in the ambulance and get to the hospital. There's nothing we could do on scene. So think about that. If you've got a really serious patient, you should be thinking, I got to get them to the hospital quick. All right. So load decision, right? Load and go versus stay and play. And then finally, this is one I add in because over my years of experience, I see this too often that people say, oh yeah, they hurt their arm, but they never actually looked at their arm. They only looked at the sweatshirt or the nice winter jacket over their arm. E stands for expose, okay? Use our scissors, use your tools to cut the clothes off. All right. And a great example is, and you can see here in the ER, they've come all the way in with this guy and he's still got all his clothes on. So the first thing they're going to do here when they get in the ER is cut them all off. We need to see everything. We need to have access to everything. And that's something we could save the hospital time doing. Plus, as EMTs and paramedics, we want to get a good look at the whole body in a serious patient to see if there's anything we've missed. And a great example would be like, this is a broken femur, the biggest bone in your body. Sometimes it can actually go compound or open where it comes out of the skin. If you didn't actually open up the pants and cut the pants off and look, you might miss this, that it's sticking out, and then it's bleeding, and now your patient's bleeding to death and you don't even know. So E stands for expose. Look for bleeding, bruising, and other. We'll talk about this word in our next video, decap beetles. All right, so that is the end. And just to sum it all up, I'll go back to this slide here, right? This is what it's all about. Our primary assessment: bleeding, ABCDE, airway, breathing, circulation, disability/decision, expose. All right, so go back. There was a lot in this video. And again, in class, we're going to get way more in depth on how to do those subparts. But make sure you know all the parts of the scene size up and all the parts of the primary assessment. We'll do those in class. And then our next week will be the secondary assessment, getting more in depth on the patient. And then after we do all of our assessment, we get to learn how to treat patients for all the different injuries and illnesses. So hope you guys like this video. See you guys in class. Go smash that like button, subscribe, and we'll see you on the next one.